Come in.
Hello, my name is Chantel. I'm a nurse and I'm going to do a physical assessment on you today. Can you tell me your name and date of birth?
My name is Koko Kudwe, and then I'm one of the first nationality.
Okay. Can you tell me where you are?
I'm in the nursing lab at Gwinnett Technical College.
And can you tell me what year it is?
We're in 2018.
Very good. So I'm going to start by taking your vital signs. I'm going to check your blood pressure, pulse, temperature, and respirations.
Okay.
Can you hold your arm up for me, please? So now I'm going to check your pulse. And if you can just sit and breathe normally. Open up, please. Place it under your tongue. Okay. Are you having any pain today?
No.
Okay. So I'm going to perform a full head-to-toe assessment on you. We're going to start with the head and neck, and then we'll move down as we complete each area. Okay?
Okay.
So if you will look up at me, I'm going to start by inspecting your face, and I'm looking to see that your eyes are symmetrical, eyebrows are symmetrical, that your nose is midline, no deviation. Noting your skin, that there are no lesions present. Your skin color is even throughout. I'm going to come behind you and I'm going to inspect your scalp, okay? So I'm going to start by just looking, and again, don't see any lesions or open areas. I'm going to palpate now, and I'm just checking for any kind of nodules that may be present, and I don't feel any. Okay. I'm going to come back around. I'm going to clean my hands before going to the next area. So now I'm going to palpate a few of the structures on your face. I'm going to start with your sinuses. Do you feel any pain or tenderness here? Any here?
No.
Okay. I'm going to palpate for your lymph nodes. And I don't feel anything there. Your temporomandibular joint. So if you can open for me and close. Okay, no clicking is noted. Inspect your tracheus. I'm going to come down and look to see, and it appears to be midline, so I'm just going to, again, palpate. Okay, and everything looks good there. I'm going to actually walk back behind you again and check your thyroid. Okay, I'm going to palpate for your thyroid gland. Swallow for me. Okay, and again. Okay, perfect. Come back to the front, and I'm going to have you make some facial expressions for me, okay? So can you smile, frown, puff out your cheeks, look angry? Okay. Now I want to check to see if you can feel certain areas when I touch them. So I'm going to have you close your eyes, and I'm going to touch certain areas, and you just tell me where you feel it, okay?
Left cheek. Right cheek. Forehead. My chin.
Okay, very good. Now I'm going to have you, I'm going to place my arms on your shoulders, and I want you to shrug for me. Okay, and then turn your head against my hand. And again. Okay, I'm going to listen in the same area, and I'm checking for any kind of bruise that may be present. Palpate for your carotid artery. I'm going to do that one at a time. Okay. Now we are going to inspect your ears. So I'm just looking again to make sure that they're positioned properly and they appear to be, I'm going to palpate your ears and put on some more blood. Do you have any problems with hearing? Good. So I want to perform a couple of tests to check your hearing. So the first test, I'm going to stand behind you and whisper a word, and you just tell me what the word is, okay?
Okay. Today. Again.
Okay, very good. Now we will perform a test called the Weber test. I'm going to use this instrument. It's called a tuning fork. I'm going to place it on your forehead and ear, so tell me if you do or do not hear sound in both ears.
Yes, I do.
So the next test is called the Renee test. I'm going to strike the tuning fork again. I'm going to place it behind your ear. When you no longer hear the sound, let me know, and then I'm going to switch the position of the tuning fork, okay?
Okay. Okay.
We're going to do the same thing on the other side.
Okay. Okay.
Perfect, thank you. I want to look inside of both of your ears. I'm going to check your, what we call the tympanic membrane. And just let me know if you feel any pain. Which is the color we want them to be. So we'll move to your nose. I've already inspected your nose from the outside. I'm actually going to use this again so that I can look inside and check for any swelling or redness. So just tilt up for me. Okay. I don't see anything there. I want to check both sides of your nose for patency. So if you will hold down one side for me and then sniff in, and then do the same with the other side. Okay, I also want to check your sense of smell. So I'm going to have you close your eyes and then tell me what you see. Very good. So now we'll look inside your mouth. I will put the gloves on again for this. I'm going to check the inside of your lips and gums and your teeth. Okay, so if you will open up for me, just a little bit. So I'm not noting any lesions present in the mouth. I'll open it for me. Palate moves appropriately. Uvula is visualized. Move your tongue, stick it out for me, and lift it up. And can you move it from side to side? Okay, very good. You can close your mouth. I want to have you open your mouth for me again. I want to check your tonsils. So if you'll open, stick your tongue out. Okay, good. So no exudate present on the tonsils. They're pink and moist. Say "ah" for me. Okay. And I want to check your gag reflex. So I'm going to stick the tongue blade pretty close to the back of your throat, okay? You feel that? Your eyes. Put gloves on. Again, I want to check your lacrimal ducts. I want to look at your sclera. And I'm just checking to see if there's any drainage noted, any redness or yellowness of your eyes. So if you look up there. Don't see any redness. Does that hurt at all?
No.
Okay, so there's no drainage present, no redness. Everything is within normal limits for your eyes. We now have to walk over to our Snellen chart, and we're going to check cranial nerve 2, which is the optic nerve. So I will have you come with me. I would like for you to cover one eye and then read the smallest line that you can read.
4.
The line 4?
Yes.
Okay, go ahead and read it for me.
MPED.
Okay, now cover your other eye. Read that line again, but read it backwards.
DEPL.
Okay, and with both eyes, neither eye covered, read the smallest line that you can read.
6.
Okay.
EDFCZP.
Very good. Okay, we'll come back into the room. Okay, so our next test is the confrontation test. So what I want you to do, I'm going to have you cover the opposite eye of me. So I will cover my right eye, you cover your left eye. And then I want you to look at my ear and tell me when my hand comes into view.
I said,
Look past my ear again, okay?
I said, I said, I said, I said,
Keep looking past my ear.
I said,
Okay, look to the other side, same thing. And just keep your gaze looking past my ear, okay? You ready?
I said, I said, I said, I said, I said, I said.
Okay, very good. You can uncover your eye. We'll now check cranial nerves 3, 4, and 6. This is checking for extraocular movements. So you're going to focus on my finger. I'm going to move it in certain directions, and you just follow it with your eyes only. Don't move your head. Okay, very good. So that last part of the test was checking the convergence and accommodation. I'm going to do a couple of tests using the ophthalmoscope. The first one is the corneal light reflex. So just going to shine the light in between your eyes. You can again just look straight ahead. Okay, and I'm checking to see that the light was reflected on the same side in both eyes.
Okay.
So the next test is a pupillary light reflex. So again, you're going to just look past me. Again, just look past my shoulder. Okay, so with that test, I was checking to see the reaction of your pupil in the opposite eye, and the pupil should have constricted, and that's what happened in both of them.
Okay.
So the last thing that I will do with the ophthalmoscope is to look into your eye structure. So I am going to get really close to you. And again, you're just going to look past me. And we get a look past my shoulder. Okay, very good. Now I'm going to inspect and palpate and listen to your back. I'm going to check for, again, any kind of lumps or nodules. I'm also going to listen to all of the lung fields. We'll start with inspection. In inspecting the skin, I don't see any abnormalities present, no lesions. Skin color is even throughout. I'm looking at the type of respirations that you have. They look even and unlabored. And so now I will move to palpation, and so you'll feel me touching on your back. Okay, no lumps or nodules noted. I'm going to palpate your spinous process. And no nodules noted there. I'm going to check for chest expansion. And all I need for you to do is take a deep breath in and out. Okay, very good. Both sides moved equally. The next thing that I want to check for is what's called tactile fremitus. So whenever you feel me place my hands on your back, say 99.
99, 99, 99, 99.
Okay, very good. So now I'm going to do what's called percussion on your back, so you'll feel me lightly tapping. Okay. And I also want to check your costal vertebral angle tenderness. So I'm going to kind of lightly strike your back, and you let me know if you feel any pain.
No pain. No pain.
Okay, very good. And lastly, while I'm back here, I'm going to listen to all of your lung fields. So I'm going to have you take a deep breath in and out as you feel my stethoscope touch your back. If at any time you feel lightheaded or dizzy, let me know. Do you have any problems with shortness of breath?
No.
Do you have any difficulty breathing?
No.
Okay. Deep breath in and out. Again. Okay, just a few more. Okay, perfect. Thank you. Okay. Okay, I'm now going to have you lay down for me. You lay back that way. Okay. So we'll just go down just to right here. That's all we need. I'm going to start by checking skin turf. No, first I'm going to start by inspecting the skin again on the chest area. Again, the skin color is even throughout, no lesions noted. So I'm going to check skin turgor. So I'm going to pinch right here, and your skin recoils quickly. Okay, now I'm going to check your costal angle. So I'm just going to place my hands here, and that should be at 90 degrees or less, and it is. The next thing I'm going to do is inspect for heaves, and I don't see any, and I want to palpate for any kind of thrills, and I don't feel anything there. So the next thing I want to check for is your apical pulse. I want to palpate for that. So following down this line here. Okay. Okay. So next, I am going to listen again with my stethoscope to your lung sounds here on the front. So again, when you feel me place my stethoscope, just take a deep breath in and out. Okay. So this time I'm going to listen to your heart sounds on certain places, and I want you to just breathe normally, okay?
Okay.
before we move on to your abdominal area, do you experience any chest pain?
No.
Do you experience any fast heartbeat?
No.
Okay. So now we will move to your abdomen. So to provide privacy, I'm going to leave the sheet here and just pull your gown up just to expose your abdominal area. Okay. So start by inspecting again, looking at the skin color, looking for the presence of any lesions. I don't see any. Skin color is even throughout. I also want to note any kind of pulsations, and I don't see any. So next I want to auscultate or listen before I start to touch on your abdomen. Okay? Again, you can just breathe normally. And so you have vowel sounds present in all 4 quadrants. I also want to listen for your aorta and renal arteries. Okay. So I want to ask just a couple of questions. When was your last bowel movement?
It was this morning at 7.
Okay, and do you have any kind of abdominal pain?
No.
Okay. The next thing that I will do is percuss for your liver span. So I'm going to have to move to this side of the bed to do that. So I'm now going to percuss your liver border, so you'll feel me again tapping on you.
Okay.
And so noting the sound change from here to here will be your liver borders. So now you'll feel me tapping again and percussing your abdominal area. Okay. And so we were listening for tympani, and I heard that throughout. Now I'm going to reach across you and percuss for your spleen. Okay. And there we were listening for the sound of dullness in that area. So now we'll palpate. I will start by pressing lightly on your abdomen and then pressing a little deeper. You tell me if you feel any pain, okay?
No pain. No pain. No pain. No pain.
Okay.
No pain. No pain. No pain. No pain.
Okay, very good. So next I will palpate your liver. And so once I get my hands in position, I'm going to have you take a deep breath, and I'm just going to see if I can feel the liver brush across my fingers. Okay. Okay, and take a deep breath for me. Okay, let it out. I'm going to reach across you now and palpate for your spleen, which I should not feel. Take a deep breath. Okay. Okay, I want to have you sit back up for me, and you can put your legs on the side of the bed. So now we'll move on and check your muscle strength and your pulses. The first thing that I want to do, just pull this down, just want to inspect your shoulder area and arms there. Okay. And now I'm going to palpate. Feel any pain
No.
or tenderness? Do you have a history of musculoskeletal disease in your family?
No.
Do you have any bone pain?
No.
Okay. Okay, I want you to grab my two fingers as tight as you can, squeeze. Okay, you can let go. And then spread your fingers out like this, and then close them up. Okay. I want to check both of your radial pulses, so just relax your arms. Okay. And I'm checking the pulses to compare them bilaterally. Okay. And the pulse strength is equal in both arms. So now I'm going to move to your lower extremity. So again, I'll just start with assessing the skin on your legs. Now do notice this discoloration right here. Can you tell me what happened?
Yes, I have a motorcycle accident when I was in high school.
Okay. Right, so we'll make note of that. Otherwise, the skin around the areas from the accident is even. No lesions are noted. So I'm going to palpate. I'm going to start up here. Keep your gown like that and just palpate. You feel any pain?
No.
Okay. Any pain on this side?
No.
Okay. So we're going to check the strength in your legs the same way we did with your arms. So I'm going to push against your legs and you push against my hands. Okay, good. And down. Okay. Is it okay for me to remove your socks?
Yes.
Okay. Okay, so I'm going to check skin color on your feet. Again, I want to check your nail beds. I'm going to check capillary refill, so we'll press down on this one. And again, it is less than 2 seconds. So I want to check the pulses in the lower extremity. So we'll start here with the popliteal. Okay. And then your posterior tibial. And then your dorsalis pedis. And I'm going to find those one at a time. Okay, very good. We'll put your socks back on. Okay, let me have you take the heel of one foot and run it down the shin of the other. Down the front. On the shin, okay. And then the other side? Okay, perfect. So the next thing that I want to do, I'm going to have you close your eyes. I'm going to move the finger on one hand in certain directions, and you tell me which direction I'm moving your finger, okay?
Okay. Up, down, right, left.
Okay, then let's do it.
Up, left, down, right.
Okay. Now you can open your eyes, which I'm going to have you close them again. I'm going to place an object in your hand, and I want you to identify the object, okay? So
Okay.
close your eyes.
It's a pen.
Okay. And now on the other side, what I will do is I'm going to draw a number in your hand and you tell me the number.
7.
Okay, very good. You can open your eyes now. Okay. Now I'm going to touch certain parts of your body with an object and you tell me which side is being touched, okay? So have you close your eyes again.
Left, right, both, right, left.
Okay, very good. So we're going to move back to your arms for just a moment. I want to check the range of motion in your wrists, fingers, and elbows. So if you can do your arm like this and down, and then move your wrist up and down. Can you turn them Your fingers, again, we're going to split them out, make a fist. Okay, very good. So the next thing I want to do is check your reflexes. I'm going to check them on both sides. You can just relax as I move through this. Check your biceps. Move and check the tricep. Okay. And then the brachioradialis. All right. And we'll do the same thing on this side before we move to your legs. So we'll start with bicep. Tricep again. Radialis on this side. Okay, so now if you will just slide back just a little bit for me so that your feet are kind of dangling, okay? And we will, actually, I'm sorry, come forward just a little bit. Come forward just a little bit. Okay. And then we'll check the Achilles back here. And then the other side. So you'll just feel the bottom of the instrument going across your foot. Okay. And there should not be any movement there. So the last part of our assessment, I want to have you stand up. I'm going to check your spine and have you do some walking. So again, just inspecting your back, inspecting the spine. Let me have you bend over for me. Okay. And there's no curvature or anything noted. You can stand back up. I want to check your cranial nerve 8. So I'm going to have you stand with your feet together and close your eyes and just close it. Okay, you can open your eyes now. And I want to watch your gait. So if you turn this way and just walk to the curtain in a regular pattern. Go ahead and walk. Okay, and turn around. And then walk back towards me, heel to toe. So go back. And then walk back towards me, heel to toe. Yes. Very good. You can have a seat. Do you have any questions for me?
Thank you so much for the assessment.
All right, thank you.